So David Kleiman here with the EMS Training Division. I have the utmost pleasure to introduce everybody out there to our Associate Medical Director, Dr. Paige Yeager. Doctor, thanks so much.
You're very
really
welcome.
Appreciate it. First off, thank you for what you do for COB Fire. Not all you guys out there know, but she's behind the scenes and helping create a lot of stuff. And one of the things I'm excited about is what you help bring to Cobb County, which is the Seal Hemostatic Spray.
Yeah.
What is this?
So this is basically a spray to help with clotting during injuries that are bleeding.
And I have the pleasure to tell you guys we're rolling out to the BLS stations. So with this training and the protocols we're about to go over to, you guys will end up getting the hemostatic spray. And we made it easy for data collection this time.
Yes.
Scan a QR code, fill it out on your phone, and we're re-delivering the product to you guys. Doc, I know we just got off the fire ground where we actually shot some pig butts, stabbed some pig butts, and you actually deployed the Seal spray.
I did.
That was much different.
So I noticed there, and you guys will hear it on there. What do the directions say?
So you want to shake it until you hear the click, and then you can remove the top and then start to spray.
And all that click tells you is that the powder is actually mixed up and we're actually built the pressure up. What is the magic distance from the wounds?
So there's a little bit of nuance to this. So if you have a more blunt injury, you want to start further away, then go in. Blunt would be, you have a messier wound from like an MVC or something that doesn't have a specific hole. That would be more considered a blunt injury.
Gotcha.
But if you have a penetrating wound, you want to start closer and fill up the wound so it goes all the way through. Anything where something goes in and out, like a bullet goes in and out, like a knife, that would be considered penetrating.
So we have penetrating trauma. We're going to start about 6 inches and move towards the wound.
Right.
But on that blunt, stay about 10 inches back so you can try to cover the whole wound.
Yes, because you're trying to cover a larger superficial area, whereas a penetrating wound has a smaller, deeper area.
Gotcha. And one of the things we noticed here when we dissected down to see if we got the actual spray all the way through the wound channels, that on larger wound channels, or if you think a bone was involved, half a can in the entrance and try your best to do the rest of the can in the exit.
Yes, because it seems like the bone can kind of disturb the tract, so it's important to get both sides if you're able to access both sides of the penetrating trauma.
What specifically about that nice deep laceration one? What did you do with your hand there?
So if you have a long injury, you want to pull the injury to the side and expose as much area as possible to get as much spray into the wound to start the clotting process.
So as you guys can see, the actual spray is going to come out this side. So just make sure this is pointed towards the injury. And you guys will see the video footage and you'll actually see how the tissue is going to expand as you went into it. Mm-hmm. So what are we using it on?
So this is primarily for injuries that involve the extremities, the junction, or superficial head injuries. So the neck, shoulders, and groin, so these are areas that are really difficult to get hemostasis with a tourniquet.
What can we not use this on?
You can't use it around the eyes because the pressure is too high. It's 80 PSI coming out, so it's a really high power spray. So that's why we want to be extra careful around the eyes, because it's not necessarily the product itself, it's really the pressure that can cause a globe damage.
So like if I have a neck wound, I need to physically make sure I got iPro on, and I need to be covering the patient's eyes as I go to administer this.
Exactly, like you want to protect your own eyes and the patient's eyes.
And don't forget to keep your mouth closed as you're about to spray.
Yeah. Yes, like eye protection and mask whenever you use this.
Yeah, if you can't remember mask, close your mouth.
Yes.
Close your mouth.
And then we also can't use it on the torso.
So no abdomen, no chest. We see skull, but we don't see brain matter. Can we use it?
Absolutely no skull fracture can you use this on. Like the bleeding scalp wound is perfect for that, but any open fracture, absolutely not.
and this is very temperature safe. They did a lot of testing, no high altitudes, extreme temperatures, so this is safe to be in the back of wherever you guys put in your BLS bags.
Right. So it doesn't have to be refrigerated or anything like that.
Hey Doc, thank you once again for doing this. We really appreciate it. If you guys have any questions, please reach out to myself or the EMS Training Division.